Prior to the assessments, allow the patients to rest for at least 5 minutes. No caffeine or nicotine at least 30 minutes prior. The patient should be positioned with back supported, arm elevated at heart level, and feet flat on the floor. Remove any excess clothing that may interfere with the blood pressure cuff or constrict flow in the arm. To choose the appropriate cuff size, wrap the cuff around the patient's arm and use the index line to determine if the patient's arm circumference falls within the range. Otherwise, choose the appropriate smaller or larger cuff. When using the stethoscope, the ear prongs should face forward. Ensure that the bell is on by lightly tapping on the diaphragm. Locate the brachial artery and align the artery marker on the cuff accordingly. Wrap the blood pressure cuff snugly around the arm. Place the manometer in a visible place prior to measurement. Place the diaphragm superior to the antecubital fossa and the brachial artery. Do not place it under the cuff. Seal the valve with the bulb by turning it all the way to the right and inflate the cuff to 180 millimeters of mercury, or 20 millimeters of mercury above the first cotocuff sound. Turn the valve to the left to release at a rate of 2 to 5 millimeters of mercury per second. Listen to the first rhythmic sounds of blood begins to flow and note the needle's location on the manometer. This would be the systolic reading. Continue to listen as the pressure drops and the sounds fade. The last cotocuff sound that can be heard is the diastolic reading. The following is a chart for categorizing obtained readings.